Imagine a time when you or a loved one might need long-term care, perhaps in a nursing home or with extensive help at home. It is a big consideration, and figuring out how to pay for it can feel overwhelming. A critical part of getting support, especially through a program like Medicaid, involves understanding how your medical needs are officially determined. So, how exactly is medical need determined for Medicaid eligibility? For Medicaid, medical need is primarily determined through a formal assessment process that evaluates an individual's functional abilities and care requirements. This assessment helps states decide if someone meets the necessary criteria for institutional care, like a nursing home, or for home and community-based services. The core reason for this assessment is to ensure that Medicaid resources are directed to those who genuinely requiring a specific level of care that cannot be met through less intensive means. It is not just about a diagnosis, but about how that diagnosis impacts daily living. States establish specific criteria for what is often called a level of care determination. This ensures fairness and consistency in who receives these vital benefits, helping to manage the extensive costs associated with long-term care. The assessment process typically involves a team of healthcare professionals, such as registered nurses and social workers. They will conduct interviews with the applicant and sometimes family members, review medical records, and observe the individual's ability to perform various tasks. This comprehensive review helps create a clear picture of the person's functional status and the type of assistance they need, leading to a recommendation for the appropriate level of care. This recommendation is then used to confirm medical eligibility for Medicaid long-term care services. Two key sets of activities are often evaluated during this process: activities of daily living, or ADLs, and instrumental activities of daily living, or IADLs. ADLs include fundamental self-care tasks like bathing, dressing, eating, toileting, and transferring, which means moving in and out of a bed or chair. IADLs involve more complex activities necessary for independent living, such as managing medications, preparing meals, housekeeping, using the telephone, and managing money. The extent of assistance required with these activities is a major factor in determining medical need and the appropriate level of care. Understanding this assessment process gives you a clear pathway to securing the care needed for yourself or a family member. By focusing on the functional limitations and care requirements, and knowing about ADLs and IADLs, you can better prepare for the eligibility determination. This clarity helps to ensure that the necessary medical support and financial assistance through Medicaid are accessible, providing much-needed relief and peace of mind for long-term care planning.